Welcome to this episode of the program, Easy Access to Healthcare for All Nigerians. My name is Aisha Muhammad Ahmed, your anchor. One strategy that the National Health Insurance Authority has adopted to help it achieve its mandate of universal health coverage is collaboration with the state social health insurance agencies under the Health Insurance One Roof initiative. This strategy decentralizes the provision of health insurance, bringing together all stakeholders within the health insurance ecosystem to work towards the attainment of universal health coverage. The importance of the health insurance under the One Roof initiative cannot be overemphasized, as the initiative has yielded quite a lot of gains. It is in that light that the NHIA organized a 3-day quarterly peer review meeting between NHIA, NASSCO, and state social health insurance agencies in Abuja. These meetings served as a platform to strengthen collaboration with stakeholders at the subnational levels. Let us bring you details as the program unfolds. Keep watching.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We're really enjoying it.
We appreciate their effort.
First on the program is a highlight of events around the NHIA. In the news, NHIA organizes workshop on compliance with Code of Conduct requirements. These alongside other stories coming your way shortly.
These are the various definitions.
The National Health Insurance Authority, NHIA, has held a workshop for staff of the authority on strict compliance with Assets Declaration and Code of Conduct to educate them on the processes and procedures required in meeting the Code of Conduct guidelines. Deputy General Manager, Appointment, Discipline and Promotion of the Human Resource Management Department, Sani Abdullahi, who represented the Director General of the NHIA, noted that the Code of Conduct is a constitutional obligation that must be strictly and properly obeyed.
Code of Conduct, as he rightly said, I'm sure, is provided under the Constitution, which means that for you to refuse to abide by the rule by filling the form, it means that you are going against the Constitution.
The workshop had 2 paper presentations on Code of Conduct for public offices in government business and how to fill the asset declaration form. Speaking in an interview, Head of Training of the NHIA, Kabiru Oladimeji Shitu, explained that the workshop was aimed at sensitizing staff who have not complied with the Code of Conduct guidelines on when and how to comply with the guidelines. He noted that the sensitization was done for staff at various cadres. He noted that staff at the zonal and state offices will also be sensitized on the Code of Conduct guidelines in due course.
There is a provision of the Constitution that talks about asset declaration by public service. So we noticed that some of our staff are not aware of it and they've not been complying because it's actually a provision that comes with penalties for people who are not complying. So we sat down and did a proposal to the management that they should allow us to sensitize our staff on it so that we will not be caught napping. So it's going to be for everybody. So after this one, we're also planning to go to the state offices and the zonal offices to sensitize all the staff so that they will be abreast of the constitutional provision that said every public service officer must complete every 4 years the Code of Conduct form to declare their assets and those of their children under 18 and their spouses.
Staff of the NHIA who participated in the training commended the NHIA for the sensitization, stating that the training has opened them up to what is required in meeting the Code of Conduct guidelines.
Me being here today, it has given me an insight on what to do every 4 years. Before now, I never expected that I was supposed to declare my assets in every 4 years as a civil servant. But today, I made me to understand that there are some code of regulation, there are some regulations, there are some things that I am not expected to do. Like as a civil servant, I cannot be a director in a company, in a public liability company. I cannot be a director, but I can go into farming. So I've made to understand that these things are what is supposed to be guided as a civil servant.
Well, this is a quite enlightening program. For you as a public servant, you need to know what you're supposed to do, what you're not supposed to do, your limitations, the regulations that encompass the whole service.
They're enlightening us to some extent, they've enlightened us on what is expected of a public servant, so what you're supposed to do to make sure that the business of the government is not be thwarted or be disrupted. So I appreciate the training.
That many of us got to know there are some things we take for granted. But from what we've just received, it's more glaring that there are things you do, the consequences come much later. Of which, for that you have to be careful while you are being in office. Because either you are still within or when you have exits, they may have to call you back because there could be records kept. And they will look who was there then. So if you are found wanting, you will definitely down to the consequences.
The management and staff of the National Health Insurance Authority (NHIA) recently held a valedictory session for the Group Manager, Special Duties, Mr. HIUOR, on his retirement from service. The Director General of the NHIA, Professor Sambo, while speaking during the event, which held at the headquarters of the NHIA, saluted Mr. Oshinlu for his contribution towards the progress of the authority. Sambo wished the retiree success in his future endeavor, reminding him that he will always be part of the authority.
Having retired from NHIA is not the end of life, but is the beginning of new life. I will pray that the life after NHIA will be more prosperous and better for him. And we will look forward for any avenue that will continue to interact with him. Having retired from NHIA does not mean that he is no longer part of the organization. Wherever he believes that he will contribute to the growth and development, continuous growth and development of this organization, our door is always open.
Mr. HIUOR, while speaking, appreciated the Director General of the NHIA, Professor Sambo, and the National Health Insurance Authority for the privilege to serve. He noted that he will not stop being an advocate of the NHIA.
It's had the privilege to work in a place, and it's time to leave. And your colleagues, led by the CEO of the agency you served, will sit like this and say, "Well done, goodbye." You really have done well.
He thanked God for keeping him alive and in good health to see the end of his service in government and for the opportunity to serve Nigeria through the NHIA. His colleagues congratulated him and wished him well as he faces his new endeavors.
HIUOR is a very pleasant person. Hardly can you see HIUOR get annoyed. Before you see HIUOR, you would have heard his laughter from a very long distance. You see him laugh, you hear him laughing. You now come out and look for him. He's a pleasant person, a peacemaker, not wanting trouble at all.
My prayer is that God will keep you, will preserve you, He will uphold you and He will strengthen you, and He will create for you a path for greatness, even as you have embarked on your second half, because this is just the beginning of the second half. You are promised 20 years. Thank you.
The program is easy access to healthcare for all. The NHIA quarterly peer review serves as a platform for the authority to meet with CEOs of state health insurance agencies across the country to discuss on how to move the health insurance sector forward. At this particular meeting, the National Social Safety Net Coordinating Office was included as the NHIA brainstormed using the social register to expand health insurance coverage. Let's get details of this meeting in our next segment, Issues Around the NHIA. Please don't go away.
The National Health Insurance Authority is a government agency that is responsible for giving succor to Nigerians through health insurance. The agency does not only cater for people in the formal sector, but also in the informal sector, especially the vulnerable who cannot pay for themselves. It also operates a decentralized system, a national body at the top and subnational at state levels. Due to this collaboration, the NHIA Gateway Basic Healthcare Provision Fund is executed at the state level under the supervision of the state's social health insurance agencies.
Well, it's not a program or a project, but it's a funding or financial intervention to the health sector, so that the health sector will have additional extra source of funding. So it's the main vehicle, financial vehicle, to finance that basic minimum package of health services as specified by the National Health Act. What is the overall aim of basic healthcare provision? The overall aim is to significantly drive the nation towards achieving or attaining the universal health coverage in line or in accordance with the National Survey Planning, Health Planning Part 2 in a long time, and the SDG in the short term.
This gateway is supervised by the NHIA and implemented at the state level, and serves as a medium that cements the relationship between the NHIA and state social health insurance agencies.
The Act clearly stated that the funding of the basic health care will be through the federal government annual grant of not less than 1% of its consolidated revenue fund. Then from donation and grant from partners and donors, and 3 from any other source like investing the fund, and also interest that we accrue from the investment, then from private sector.
In a bid to strengthen its decentralization strategy with states, the NHIA organized a quarterly peer review meeting between NHIA, National Social Safety Net Coordinating Office (NASSCO), and state social health insurance agencies.
We have
the meeting held in Abuja. The objective of the meeting was to review and address issues emanating from the previous meetings with the state social health insurance agencies, SSHIAs, and the NHIA. Educate the SSHIAs on the focus of the NHIA for 2023. Update the state on progress made in the implementation of health insurance under one roof. Discuss challenges of collection, collation and integration of data. Discuss the need for partners mapping to address the issue of fragmented partner support across the state and country. Brainstorm with NASSCO on exploring the use of social register to expand health insurance coverage.
It is my pleasure to welcome.
Speaking at the event, Professor Nasir Mohammed Sambo, Director General NHIA, said the success of the collaboration between the NHIA and the states represent the health insurance picture in Nigeria and will bring about the attainment of universal health coverage.
As we are all aware, the health insurance space in Nigeria is decentralized. There is a national body at the top, and there are subnational levels. And the aggregate of what these two levels do brings the totality of the picture of the social health insurance in Nigeria. And where you have a decentralized system, there must be a very credible coordinating mechanism to be able to have a platform where ideas will be shared, where ideas can be cross-fertilized, where challenges can be collectively identified, and where solutions to the challenges can be collectively addressed.
That is why under our reform system or our rebranding agenda, we say that strategic stakeholders engagement is one of the key elements in the second pillar of our rebranding agenda.
Setting the ball rolling was a presentation by Dr. NHIA on the strategic focus for the year 2023.
Our focus for 2023. Two things. We are preparing for the big picture and we want to consolidate on existing strategies. Not all the strategies, we just selected a few that we should really focus on. So how do we prepare for the big picture? Essentially, we want to implement the NHIA Act 2022. It's been signed, we've been waiting for over 20 years, so now it's been signed, what next? So we said we're going to constitute and inaugurate 3 committees, like the DG mentioned earlier. The Committee for the Development of the Operational Guidelines, the Committee for Implementation of Mandatory Health Insurance, and the Committee on Innovative Financing, primarily for the Vulnerable Group Fund. So those 3 committees, as was mentioned, one of them has already been inaugurated and has started work. The other focus is consolidating on the existing strategies. And we asked ourselves, how do we leverage existing strategies so that we can scale up health insurance coverage? And we selected a few strategies. One is to strengthen information, education, and communication. Information to all our stakeholders, information to our enrollees, even information within ourselves as an organization, from the person at the top to the least person within the organization. They should have the information that they need to function optimally.
Dr. Sikiru Salawuddin, Acting General Manager, Informal Sector Department, gave a presentation on the implementation of BHCPF, success, challenges, and the way forward.
So far, so good. As at January 2023, the authority or the gateway has received and disbursed a total sum of 39,592,429,726 naira.
High point of the event was the interaction between NHIA, SSHIA, and National Social Safety Net Coordinating Office, NASSCO. Its objective includes to review utilization of National Social Register, NSR, by state social health insurance agencies for the identification of the poor and vulnerable households for enrollment into the BHCFP. Explore the possibility of expansion of the social registers in the states, amongst other issues. Speaking at the event, Dr. Gaza Gwamna, Chairman, Forum of State Health Insurance CEOs, speak on the impact of the meeting.
They give us opportunity to be able to review what we've done, what we're doing, and then to see what we're going to do and do it better. So this has been able to help us in the implementation of, different schemes, especially the Basic Care Provision Fund that will have direct connection with the NHIA as far as funding flow is concerned. So it's been able to better the scheme, because when we started 2-3 years ago, we were not at this level. And now at least we've been able to make some advancement, we've have some gains, though it's not been perfect, but at least when we come like this, we're able to look at some of those challenges so that we perfect our strategies, and that has actually helped a lot. So perfecting our strategies, it's not just coming around to just come and talk theory. Some experience sharing always come from the field, and when we put them together, we proffer solutions collectively, and then we'll go back and implement them.
Welcome back. Today on our Stakeholders segment, we'll bring you interview with participants of the 3-day peer review meeting with CEOs of state social health insurance agencies. They speak on the significance of the meeting.
The meeting is very significant, it's very important, and I am very much happy that I am around because it's moved me beyond what is written in a paper to what is practical. And the discussion so far has shown that insurance can be achieved. It is a practical activity that if you do it within the confinement of law, you are going to achieve results.
This is a vision of the new DG of the authority to bring all the health insurance stakeholders under one roof. So every 3 months, we gather to review our performances and to take action on any challenges that we are facing. So we are very happy that we have this kind of leadership at the national level, that we are gathered and the leadership of the NHIA listens to our challenges and try to address them.
Some say it is important and necessary as it will help put the health insurance space on a good trajectory of attaining universal health coverage.
It's important that while policies are laid out at federal level, you listen to those that are actually implementing, you get the feedback, and we are able to now, in real time, monitor what we're doing and ensure that we are moving in the right direction. So definitely, I feel that these quarterly review meetings are very necessary and extremely important.
This gathering provides us with the opportunity to do a quarterly review of our relationship and the workings towards achieving universal health coverage in the country.
Dr. Chidi Ubani Ukoma said, with the health insurance under the One Roof initiative, the impact of such meetings cannot be overemphasized.
Yes, health insurance under one roof, that's where all the stakeholders in the health insurance ecosystem come together. NHIA at the top and the shares. That's where we have this peer review meeting, quarterly review meeting with all the shares. So with all the ideas that have come up, all the deliberations, and charting a way forward, if we can implement all that we've reviewed today in this first quarterly meeting, I believe it will place all the stakeholders, NHIA, together with the shares on a pedestal to working with other stakeholders, that is the Federal Ministry of Health, National Primary Healthcare Development Agency, to achieving universal health coverage for our country, Nigeria.
Participants of the 3-day meeting giving us their perspective of the review meeting. Up next, your questions answered. Do stay tuned.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: does NHIA cover delivery commodities?
NHS, when we talk about delivery, what NHS does is that there's a difference, a little difference, or when you say the word commodities of a wider range. So what NHS does is that it covers all the drugs and also the consumables. The word consumables are the ones that are more of medically related. Things like syringe and needles, things like gauze that they use during the delivery, things like cotton wool, and things like sutures that they use for the suturing during the process. But other commodities like soap, like sanitary pad, like the diaper pack that they use to clean the baby, such type of commodities are not covered under the scheme. So I think the enrollees or our mothers that are going, that is to the maternity area, should get this thing clear, that it is only the consumables that are being covered.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
And so, we draw the curtains on this week's episode of the program. Please make sure you visit any state office of the NHIA for complaints or redressal on issues encountered in the course of access and care. See you next week.